Sexual difficulties are far more common than most people realize, yet they remain among the least discussed health concerns in everyday life. Behind closed doors, many individuals carry silent worries about their sexual performance, their body, or their ability to satisfy a partner. For men in particular, these concerns often become tangled with identity, confidence, and self-worth because cultural conversations about masculinity frequently emphasize performance and endurance. Even small challenges in the bedroom can feel overwhelming. In clinical practice, it is not unusual to meet men who have been struggling quietly for years before seeking help. Some arrive with mild frustrations, while others carry an immense emotional burden. For a portion of these men, sexual concerns begin to affect relationships, mental health, and overall quality of life. In extreme situations, the distress can become so severe that individuals withdraw from intimacy entirely, believing that something about them is fundamentally broken. One of the most common conditions contributing to this cycle of shame is premature ejaculation, a condition estimated to affect roughly 1 in 3 men at some point in their lives. Despite how widespread it is, it remains surrounded by myths, jokes, and misunderstandings. Popular culture often treats the issue as comedic material, which may seem harmless on the surface, but can deepen the embarrassment felt by those experiencing it. Instead of encouraging open conversations, these attitudes often push people further into silence. When a man struggles with rapid ejaculation, the experience is rarely as simple as finishing too quickly. Many describe a deeper loss of control over their bodies. They may feel as though their arousal rises suddenly and uncontrollably, leaving little time to slow down or adjust. Some report that the experience is not even particularly pleasurable, but instead feels like a reflex that happens before they can truly enjoy the moment. This loss of control can quickly become intertwined with anxiety. Once a person has experienced a few disappointing sexual encounters, the fear of it happening again often becomes part of the experience itself. The body begins to anticipate failure before intimacy even begins. Instead of focusing on pleasure or connection, the mind shifts toward monitoring performance. Will this happen again? What will my partner think? How do I stop it? These thoughts may seem small, but they activate powerful physiological responses. Anxiety triggers the body's stress system, which prepares us for threats by increasing heart rate, tightening muscles, and sharpening attention. While this reaction is helpful when facing danger, it is not ideal for sexual experiences that rely on relaxation, emotional connection, and gradual arousal. As anxiety rises, the body may move even more quickly toward climax, reinforcing the very problem the person is trying to avoid. Over time, a pattern forms. Anticipation leads to stress. Stress leads to loss of control. The experience then confirms the person's fears, making the next encounter even more stressful. For many men, this cycle becomes deeply discouraging. Some begin to avoid sexual situations entirely to prevent embarrassment. Others withdraw emotionally from partners because intimacy feels like a source of pressure rather than connection. In relationships, this withdrawal can easily be misinterpreted. A partner might assume the man has lost interest or does not care about their pleasure, when in reality, he may be feeling intense shame about his own body's responses. Unfortunately, the social environment surrounding sexuality often makes these conversations even harder. Many people grow up receiving mixed messages about sex. On one hand, there is enormous cultural emphasis on sexual performance and desirability. On the other hand, open discussions about sexual challenges remain uncommon in families, schools, and even medical settings. As a result, people may enter adulthood with little understanding of how normal it is to encounter difficulties or how treatable many of them are. Adding another layer to this issue is the influence of modern media and pornography. Sexual imagery is now more accessible than at any point in history, and it frequently portrays unrealistic expectations about bodies, stamina, and pleasure. Many young men learn about sex primarily through these portrayals rather than through realistic education or personal experience. This can create the impression that sexual encounters should look effortless and flawless, with instant erections, prolonged endurance, and simultaneous orgasms. The reality, of course, is very different. Human sexuality is complex, emotional, and influenced by countless biological and psychological factors. Real relationships involve communication, vulnerability, and sometimes awkward moments. Yet, when individuals compare their experiences to scripted performances designed purely for visual entertainment, they may conclude that something is wrong with them when their bodies behave like normal human bodies. Another common misconception involves how men believe they should manage ejaculation. A widespread belief suggests that tightening the pelvic muscles during arousal can delay climax. Many men instinctively attempt to clench these muscles as they approach orgasm, hoping to maintain control. While the intention makes sense, This strategy often has the opposite effect. The pelvic floor muscles play an important role in sexual function, but excessive tension in this area can accelerate ejaculation rather than prevent it. When the muscles remain chronically tight, the body becomes primed for the contractions that occur during orgasm. Instead of creating control, the tension may push the body further along the path toward ejaculation. Over time, repeated tightening can even lead to additional symptoms. Some men develop pelvic discomfort, urinary urgency, or pain during erections or ejaculation because the muscles never fully relax. What began as an attempt to gain control becomes another source of physical stress. Understanding these dynamics helps shift the conversation from blame to physiology. Sexual responses are deeply connected to the nervous system, muscles, breathing patterns, and emotional state. When someone learns how these systems interact, it becomes easier to approach sexual health as a skill that can be developed rather than a fixed trait that determines worth or masculinity. One important insight that emerges from both clinical work and sexual health research is that pleasure and control are closely linked to relaxation. The body's parasympathetic nervous system, the system responsible for rest and recovery, plays a major role in arousal and sustained erections. When this system is active, blood flow improves, muscles soften, and the mind becomes more present in the experience. In contrast, when the body remains locked in stress mode, the sympathetic nervous system dominates. This is the same system that prepares us for danger, and it tends to speed up physiological responses rather than slow them down. For someone struggling with premature ejaculation, the challenge often lies in learning how to shift from this anxious state into one of calm awareness. This realization opens the door to a very different approach to sexual health. Instead of focusing solely on techniques designed to delay ejaculation, the focus shifts toward understanding the body's signals, learning to recognize how arousal builds, how anxiety influences the process, and how breathing and relaxation affect the pelvic muscles can transform the experience of intimacy. Many experts in sexual therapy emphasize that the journey toward better sexual control often begins with self-awareness rather than performance strategies. This means paying attention to sensations in the body, noticing how arousal develops, and recognizing the early signs of tension or anxiety before they escalate. In some ways, this process resembles learning any other skill that involves the body, such as playing an instrument or mastering a sport. Progress rarely happens overnight. It involves curiosity, patience, and practice. Yet, when individuals approach sexuality with the same mindset they might bring to learning a new physical skill, the experience becomes far less intimidating. Ultimately, sexual health is not about meeting unrealistic standards or comparing oneself to others. It is about developing a healthy relationship with one's own body and understanding how to create experiences that are pleasurable, connected, and satisfying for both partners. By replacing shame with education and curiosity, individuals can begin to break the cycles of anxiety that often fuel sexual difficulties. As we continue exploring this topic, it becomes clear that premature ejaculation is not simply a mechanical problem. It sits at the intersection of physiology, psychology, and relationship dynamics. Understanding how these pieces fit together provides a powerful foundation for change, and it reveals that many of the tools needed for improvement are far more accessible than most people imagine. Once people begin to understand that premature ejaculation is influenced by the nervous system, muscles, and emotional responses, not simply willpower, the conversation about treatment changes dramatically. Instead of asking, how do I force my body to last longer? The more useful question becomes, how do I work with my body rather than against it? In sexual medicine, it helps to think about arousal as a gradual process that unfolds over time. Most clinicians describe it as an arousal curve. At the beginning of this curve, someone might feel mild interest or curiosity about sex. As stimulation continues, physical and emotional excitement grows. Eventually, the body reaches a point where orgasm becomes inevitable, the point of no return, followed by ejaculation. For many men with premature ejaculation, the difficulty lies in how quickly they travel along that curve. Instead of gradually moving through stages of pleasure, their bodies accelerate from early arousal to orgasm in a matter of seconds or minutes. It can feel like stepping on the gas pedal of a car with no functioning brakes. But arousal is only part of the story. Anxiety often runs alongside it like a second curve rising at the same time. When a person becomes worried about performance embarrassment, or disappointing a partner, the nervous system becomes activated. That activation can push the body even faster toward climax. Imagine someone whose arousal level is increasing from a calm 1 to a heightened 9 or 10. If anxiety climbs alongside it, the nervous system may shift into a fight or flight state. In that state, relaxation disappears and the body becomes tense. Muscles tighten, breathing becomes shallow, and control becomes much harder to maintain. In other words, anxiety doesn't just accompany premature ejaculation, it frequently accelerates it. Many men describe this experience as a sense of panic. They might feel their heart racing or their body tightening as arousal builds. In those moments, the mind often begins running through a series of anxious thoughts. It's going to happen again. I'm about to lose control. My partner will be disappointed. Ironically, these thoughts often push the body even faster toward the outcome they fear. What makes this situation particularly painful is that many men deeply care about their partner's experience. Contrary to stereotypes suggesting indifference, a large number of men who struggle with rapid ejaculation report feeling intense guilt or embarrassment. Some even begin avoiding dating or intimacy altogether because the emotional burden feels too heavy. In therapy settings, it is not uncommon to hear stories of individuals who stop pursuing relationships entirely. They might meet someone they find attractive, enjoy spending time together, and even feel hopeful about the connection, only to suddenly withdraw once the possibility of sex arises. To an outside observer, this behavior might appear confusing or even rude. But internally, it is often driven by fear and shame. Because of these emotional layers, treating premature ejaculation often requires more than mechanical techniques. Education about the body is important, but learning to regulate the nervous system is equally essential. One of the most powerful tools for this regulation is something surprisingly simple: breathing. Breathing patterns directly influence the autonomic nervous system, the system responsible for regulating stress and relaxation responses. When breathing becomes slow and deep, particularly through the diaphragm, the body receives signals that it is safe to relax. Heart rate slows, muscles soften, and the mind becomes more present. In contrast, shallow or rapid breathing reinforces stress signals. The body interprets these patterns as signs of urgency or danger, which increases muscle tension and makes relaxation more difficult. For this reason, many sexual health specialists teach patients to focus on slow, controlled breathing during moments of arousal. Instead of holding their breath or breathing rapidly, they practice inhaling and exhaling at a steady rhythm. Some clinicians recommend inhaling for several seconds and exhaling for the same duration, allowing the body to settle into a calmer state. Although this may sound almost too simple, research supports its effectiveness. Studies examining behavioral techniques for premature ejaculation have shown that breathing exercises, particularly when combined with mindfulness and relaxation training, can significantly extend the time before ejaculation occurs. Another important aspect of this approach involves the pelvic floor muscles. These muscles support the bladder, bowel, and sexual organs. During orgasm, they contract rhythmically as part of the ejaculation reflex. Many men struggling with premature ejaculation unknowingly keep these muscles clenched during sexual activity. The tension might begin even before intimacy starts, especially if the person feels anxious or pressured to perform. Over time, the pelvic floor can become chronically tight, which increases sensitivity and accelerates the ejaculation reflex. Instead of strengthening these muscles further, as many people assume, the goal for some men is actually to learn how to relax them. This relaxation can be practiced by becoming aware of the pelvic area during breathing. When someone inhales deeply and allows the abdomen and pelvic floor to expand gently, the muscles naturally soften. On the exhale, they return to their resting state without forceful contraction. Although the technique may sound subtle, it has powerful effects. When the pelvic floor relaxes, the body becomes less primed for ejaculation. Combined with slow breathing, this approach helps reduce the sense of urgency that often accompanies rising arousal. Developing awareness of the body is another key step. Many men who struggle with rapid ejaculation have never learned to notice how their arousal builds over time. Instead, they experience sexual stimulation as a rapid progression from excitement to climax with little awareness of intermediate stages. Mindfulness practices can help bridge this gap. Mindfulness simply means paying attention to present moment sensations without judgment. In sexual health therapy, this might involve noticing physical sensations in different parts of the body, breathing, muscle tension, heartbeat, or subtle shifts in arousal. For example, a person might practice noticing early signs of excitement, such as warmth, tingling, or increased sensitivity. By recognizing these signals earlier in the process, it becomes easier to adjust breathing, relaxation, or stimulation before reaching the point of no return. Many therapists encourage patients to begin practicing these skills during solo sexual activity rather than immediately with a partner. This removes performance pressure and allows individuals to explore their bodies at their own pace. Masturbation becomes an opportunity for learning rather than simply a quick release. During this exploration, the goal is not necessarily to avoid orgasm entirely. Instead, it is to become familiar with different levels of arousal and learn how to move up and down that curve intentionally. This might involve pausing, slowing stimulation, adjusting breathing, or shifting attention to other parts of the body. Over time, individuals often discover that their bodies are far more responsive to these adjustments than they previously believed. Another concept that can help reshape the sexual experience involves expanding the focus of pleasure beyond the genitals. Many people, especially men, grow up believing that sexual pleasure is concentrated almost entirely in the penis. As a result, sexual encounters become highly goal-oriented, centered around maintaining an erection and reaching orgasm. But the human body is filled with nerve endings capable of producing pleasure. Touch, warmth, pressure, and movement can create pleasurable sensations throughout the entire body. When attention expands to include these sensations, the experience of sex often becomes more relaxed and less focused on performance. In some cases, individuals describe this shift as transforming sex from a race toward orgasm into a broader exploration of sensation. Instead of rushing toward the finish line, they learn to enjoy the journey itself. This shift can also change how orgasm feels. For some men who have struggled with premature ejaculation for years, ejaculation has become more of a reflex than a pleasurable event. By slowing down and allowing arousal to build more gradually, the body has time to engage more fully in the experience. The result is often a more satisfying climax. It is also important to recognize that sexual skills develop at different speeds for different people. Some individuals notice improvements within weeks of practicing relaxation and breathing techniques. Others may require several months before their bodies begin responding consistently. Patience becomes an essential ingredient in this process. Just as learning a musical instrument requires repetition and practice, learning to regulate arousal takes time. The nervous system gradually adapts as new patterns replace old ones. Unfortunately, impatience is one of the biggest obstacles people encounter. In modern culture, many individuals expect immediate solutions to complex problems. When progress takes longer than expected, they may become discouraged and abandon the process prematurely. But when people approach sexual health as a skill rather than a fixed trait, the journey becomes far more manageable. Each small improvement, greater awareness, better relaxation, more control over breathing, builds toward long-term change. In the next chapter, we will explore how these tools can be integrated into real relationships, how communication with partners influences sexual confidence, and how couples can rebuild intimacy when shame or anxiety has created distance. Sexual well-being is rarely achieved through technique alone. It grows through understanding, patience, and a willingness to rediscover pleasure together. When conversations about sexual challenges begin shifting from performance to understanding, something important happens. Shame starts to loosen its grip. Many individuals who struggle with sexual concerns assume that the solution must involve complicated techniques or medical treatments. While medication and therapy can certainly be useful in some situations, one of the most powerful changes often begins with perspective. Sexuality is not a fixed skill that people either possess or lack. It is something that evolves throughout life. Bodies change, relationships change, and emotional needs shift over time. The sexual experiences someone has in their early 20s will rarely look the same in their 30s, 40s, or beyond. When people expect their sexual responses to remain static, they often interpret normal changes as signs that something is wrong. In reality, sexual well-being is more like a language than a performance. It develops through communication, curiosity, and practice. When couples are willing to learn together and adjust over time, intimacy can remain satisfying even as circumstances evolve. One of the most helpful steps for individuals dealing with premature ejaculation or any sexual difficulty is learning to slow down the entire experience of intimacy. Modern life encourages speed in nearly every area. Meals are rushed, schedules are packed, and digital distractions constantly compete for attention. These habits often carry over into sexual encounters, where the focus shifts toward reaching orgasm quickly rather than experiencing the full range of sensations along the way. Slowing down changes that dynamic entirely. When partners allow more time for touch exploration and connection, the body has an opportunity to settle into a calmer state. This slower pace naturally reduces anxiety and allows arousal to build more gradually. For many people, simply removing the pressure to rush toward intercourse or orgasm can dramatically improve control and enjoyment. Slowing down also creates space for communication, which remains one of the most overlooked aspects of sexual health. Many couples assume they should instinctively know what their partner likes or dislikes. When that expectation is not met, disappointment or confusion can follow. Yet very few people receive meaningful education about how to talk openly about sexual pleasure. One small shift that can make a significant difference is learning how to ask questions that encourage guidance rather than simple yes or no answers. For example, instead of asking, "Do you like this?" a partner might ask, "Would you prefer slower or faster?" or softer or firmer. These types of questions invite collaboration rather than evaluation. They allow both partners to adjust and discover what feels best without the pressure of perfection. Another important aspect of intimacy involves recognizing subtle signals from a partner's body. Not everyone communicates pleasure through dramatic reactions or verbal expressions. In many cases, the clues are more subtle: changes in breathing, small shifts in movement, or the way someone leans toward or away from touch. Learning to notice these signals takes patience and attention, but it often leads to a deeper sense of connection. Beyond technique and communication, couples must also navigate the reality that sexual desire naturally fluctuates in long-term relationships. Cultural narratives often suggest that passion should remain constant if a relationship is healthy. In truth, desire tends to rise and fall in response to stress, work demands, parenting responsibilities, hormonal changes, and countless other life factors. This variability is one reason some couples eventually find themselves in what researchers call sexless relationships. Depending on how the term is defined, studies suggest that between 15 and 20% of long-term relationships experience very little sexual activity. For some couples, this arrangement works because both partners feel content with the level of intimacy they share. For others, the lack of sexual connection becomes a source of frustration or sadness. When couples begin drifting toward a sexless dynamic, the change rarely happens overnight. Often the earliest signs appear in small shifts, less frequent touching, fewer spontaneous kisses, or a gradual decrease in playful affection. Over time, these subtle changes can accumulate until physical intimacy nearly disappears. Interestingly, many couples become touchless long before they become sexless. Physical affection such as hugging, cuddling, or holding hands may fade because one partner worries that any touch will lead to pressure for sex. When that fear develops, both partners may begin avoiding contact entirely, even though they still crave closeness. Rebuilding intimacy in these situations often begins by removing the pressure associated with sexual activity. Some therapists encourage couples to temporarily take intercourse off the table while focusing on non-sexual touch and connection. This approach allows partners to rediscover physical closeness without anxiety about expectations or performance. During this process, communication becomes essential. Conversations about intimacy can feel uncomfortable at first, especially for couples who have never discussed these topics openly. However, treating these discussions as ongoing dialogues rather than one-time confrontations can make them much easier to navigate. For example, instead of raising the issue in the middle of a stressful day, couples might set aside dedicated time to talk about their relationship. Approaching the conversation with curiosity rather than accusation can help both partners feel safe enough to express their needs and concerns. Sometimes the reasons behind a loss of desire are relatively straightforward: fatigue, hormonal changes, or overwhelming life responsibilities. In other cases, deeper emotional factors may be involved. Past experiences, relationship conflicts, or unresolved stress can all influence how comfortable someone feels with intimacy. When partners approach these challenges with patience and empathy, they often discover that intimacy can evolve in ways they never expected. What initially appears to be a problem sometimes becomes an opportunity to build stronger emotional and physical connections. Another topic that frequently arises in discussions about sexuality is the influence of pornography and sexual media. These resources can have both positive and negative effects depending on how they are used. For some individuals, erotic media introduces new ideas or fantasies that enhance creativity and curiosity within their relationships. For others, excessive reliance on visual stimulation can interfere with the ability to experience arousal through imagination or real-life connection. The key issue is balance. Human sexuality thrives when multiple elements are present: physical sensation, emotional connection, and imaginative desire. When one element becomes dominant, such as relying entirely on visual stimulation from pornography, other aspects of sexual experience may begin to fade. This is why some clinicians encourage individuals to occasionally explore arousal without external media. Using imagination and paying attention to bodily sensations helps maintain the brain's natural ability to generate desire internally. Like any skill, the more this capacity is practiced, the stronger it becomes. As technology continues to evolve, new questions about intimacy will inevitably arise. Artificial intelligence, Virtual reality and digital companionship are already beginning to reshape how people interact with sexuality and relationships. While these developments important concerns about loneliness and connection, they also highlight a deeper truth: humans are fundamentally wired to seek intimacy. Even when technology offers substitutes, most people continue to crave authentic relationships with other human beings. The warmth of touch, the unpredictability of shared emotions, and the vulnerability of real connection remain experiences that technology cannot fully replicate. For this reason, cultivating healthy sexual relationships ultimately comes back to a few simple principles: curiosity, patience, and compassion. Curiosity encourages people to explore their bodies and their partners without judgment. Patience allows time for growth and adaptation when challenges arise. Compassion reminds us that everyone, no matter how confident they appear, carries insecurities about intimacy. When individuals embrace these principles, sexual health becomes less about achieving perfection and more about building connection. Difficulties such as premature ejaculation, mismatched desire, or performance anxiety no longer define a person's worth or their relationship's potential. Instead, they become opportunities for learning and growth. At its core, sexual well-being is not just about physical pleasure. It is about feeling comfortable in one's own body, communicating openly with a partner, and creating a space where intimacy can unfold naturally. When people approach sexuality with openness rather than fear, they often discover that the most meaningful aspect of intimacy is not how long it lasts, but how deeply it connects them to themselves and to each other.